Here are some alternative diagnostic tools for mesothelioma that can be used in addition to or in place of standard biopsies. Mesothelioma is a type of cancer that develops from the mesothelium, which is a protective lining that covers most of the body's internal organs. The mesothelium lining the lungs, pleura, heart, pericardium, abdomen, peritoneum, and testes, tunica vaginalis, is particularly susceptible to malignant mesothelioma. Some key alternative diagnostic tools for mesothelioma include thoracoscopy. This minimally invasive surgical procedure uses a thin, lighted tube, thoracoscope, inserted between the ribs to examine the lungs, lymph nodes, and lining of the chest cavity, pleura. Thoracoscopy allows doctors to visually inspect for signs of mesothelioma and obtain tissue samples for biopsy with minimal trauma to the patient compared to traditional open chest surgery. Pleural fluid analysis. When fluid or masses accumulate in the pleural space surrounding the lungs, doctors may do a thoracentesis to drain and analyze the fluid. Examining pleural fluid under a microscope and performing cytokine and tumor marker tests can help detect malignant mesothelioma cells without requiring a more invasive biopsy. Endoscopic examinations. Gastrointestinal mesotheliomas in the abdomen can sometimes be visualized and biopsied using flexible endoscopes inserted through the mouth or anus. Endoscopic ultrasound, EUS, combines endoscopy with high-frequency ultrasound to precisely guide fine needle aspiration biopsies of mesotheliomas in the chest or abdomen. This provides tissue samples with a minimally invasive outpatient procedure. Serum biomarker tests. Certain tumor markers released into the bloodstream by mesothelioma cells can help support a diagnosis. Tests for soluble mesothelin-related peptides, SMRP, osteopon, megakaryocyte potentiating factor, MPF, and fibrillin-3 levels in serum may indicate the presence of malignant mesothelioma, especially when medical imaging also suggests tumors consistent with the disease. Serial testing over time can help monitor treatment response and detect recurrence earlier as well. Imaging technologies. High-resolution computed tomography, HRCT, scans of the chest provide detailed cross-sectional images to detect thin tissue plaques and fluid accumulations characteristic of mesothelioma. Positron emission tomography, PT, scanning combined with CT can reveal if suspicious nodules seen on HRCT are metabolically active, signifying malignancy. Magnetic resonance imaging, MRI, may also help visualize peritoneal mesotheliomas in the abdomen and differentiate between tumor versus scarring. Molecular diagnostic tests. Mesothelioma tumors have distinct genetic fingerprints that can now be detected using molecular diagnostic techniques like polymerase chain reaction, PCR, analysis of biopsied tissue or body fluid samples. Tests like BAP1 immunohistochemistry look for loss of tumor suppressor protein expression specific to mesothelioma versus other carcinomas. Gene expression profiling and next-generation sequencing are also being studied to improve diagnosis, predict prognosis, and guide treatment selection. Histopathological examination. Ultimately, a confirmed mesothelioma diagnosis still requires visualization of characteristic histological features under a microscope by an experienced pathologist. These include epithelioid, sarcomatoid, or biphasic cell types and growth patterns invading through tissue planes. Immunohistochemical staining for markers like calretinin, cytokeratin 5-6, WT1, and D240 can support the diagnosis but are not proof alone. Correlating clinical and radiological findings with histopathology provides the most accurate diagnosis. While a definitive mesothelioma diagnosis still requires tissue sampling and microscopic analysis, the above minimally invasive tools provide alternatives to traditional open biopsies by allowing doctors to obtain diagnostic tissue and fluid samples with improved safety, accuracy and speed. Combining clinical findings with results from multiple diagnostic modalities strengthens diagnostic certainty and guides personalized treatment decisions for this challenging cancer. Continued refinements in imaging, molecular testing, and minimally invasive techniques hold promise to further improve early detection and diagnosis of mesothelioma.